Hello friends and my dear student. Today we will learn about a important parasite which cause a vector-borne disease and it is present in the blood circulation. So I am talking about lymphatic filariasis, and in the today video we will learn what are the clinical features and how this filariasis occur, that is the pathogenesis regarding this disease. So let's start. This filariasis is caused by a nematode, and this nematode they can cause the lymphatic filariasis or they can cause the ocular and the cutaneous filariasis. That depend upon the different type of pathogens. Now these filarial nematodes, they reside in the lymphatic system, skin and subcutaneous tissue, rarely in the body cavities. So the lymphatic filariasis mainly affecting lymphatics, and in a long term, if this infection persists, it can cause a complication that is due to the chronic obstruction and the fibrosis of the lymphatics. The causative agent for the lymphatic filariasis is Wucheria bancrofti, Burgea malai and Burgea temore. So Wucheria bancrofti is the main pathogen which is responsible in more than 90% of the cases, and we can also say that if it's a Wucheria bancrofti, we can say Bancroftian filariasis. Now the cutaneous and the ocular filariasis. So this includes by the lower that is responsible for the ocular filariasis, that Onchocerca volvulus and this Manzanella species, they are residing in the skin and subcutaneous tissue. So they are responsible for that filariasis. So these are very important MCQs. This can come, they can be asked in the Viva question. What are these different filariasis caused by which pathogen? Now we talk about of this parasite, what is morphology and where it is residing. So this filarial nematode is a viviparous. So usually most of the parasites, they are oviparous. That means they are giving the eggs. But in the filarial nematode, they are viviparous, means there is no egg stage, only the adult worm and the larva. Now this parasite, it exists in two morphological form. One is the adult worm and another is the larva. Now this adult worm is approximate 2 to 10 centimeter in length, and this worm has the property that it can survive for many years if you are not giving any treatment to the patient, and it can lead to obstruction in a longer time. It can cause obstruction, then it can lead to so many complications due to this obstruction. So what are the complications related to it? When there is a chronic obstruction, so it can cause elephantiasis, that is the hathi pav, and hydrocele. So this disease in Hindi being said as hathi pav. So elephantiasis and hydrocele, which is seen and known as the lymphatic filariasis. Then another stage is the microfilaria. So one is the adult form and second is the larva form, that is the microfilaria, which is present and which is the diagnostic form. So when you are diagnosing any sample from the patient that is going for the microscopy, so there you will find this stage microfilaria. Now this microfilaria is non-pathogenic, but sometimes the hypersensitivity reaction can occur. So if it is present in the lung, they can be microfilaria antigen and it can lead to the tropical pulmonary eosinophilia. So this is a hypersensitivity reaction in response to the microfilaria. Now this microfilaria is normally not always present in the blood. Basically the microfilaria, which is the you can say it is the L1 larva, it is present in the blood circulation, but not always. So there is a timing. Periodicity means there is a timing when it will be present in the blood. So there is nocturnal or diurnal, subperiodic or non-periodic. Nocturnal periodicity means if the this microfilaria is present in the blood in the night time, that is 9 p.m. to 4 a.m. and this means shown by Wucheria and the Burgea. Diurnal means 12 noon to 2 p.m. that is in the daytime. This is being seen by in case of lower. Then comes the subperiodic, so it is present throughout. And non-periodic, that is the no periodicity is noticed, that is in case of Onchocerca and Mansonia. So there you don't have to wait for that you will able to see this microfilaria in the night or day. So there is no such periodicity in case of these two pathogens. So lymphatic filariasis, 90% cases Bucheria, 10% cases Burgea malai, and Timori is very rare. So it is characterized by chronic obstruction. I have already told you about that it can lead to in a when there is a long time and the parasite is present in your body, it will cause the chronic obstruction and fibrosis, which can lead to the various complications like of elephantiasis, lymphedema, and the hydrocele. Now, where these infections are mainly present, which countries are being affected, that is the Southeast Asia shows the highest burden. So 50% of the total world infected patients, they are mainly present in the Asia, followed by the sub-Saharan Africa. Now, highly endemic states in India, that is the maximum cases are being noticed in Uttar Pradesh, followed by Jharkhand, Bihar and West Bengal. So these four states are responsible for 2/3 of the filariasis burden in India. Now we come to the Bancroftian filariasis. So how this parasite causing the infection, how it is entering in your body, that is, it is by the bite of the female mosquito. So this female mosquito can transmit the infective form. So definitive host is the person and intermediate host is the mosquito. So the L3 filariform larva is the stage which can infect the human being. So that is very important whenever any spots or any slide being given in the spotting. There they can ask what is the infective stage, who is the definitive host, what are the symptoms, what are the complications. So these are the side questions which can be asked in the grand viva or it can be asked in the spotting as a side questions. So L3 filariform larva is the infective form, which is when the mosquito bites, so it will deposit on the skin. From the skin, it will migrate to the local lymph nodes and the L3 larva develop to the adult worm. Now this adult worm in the lymphatic system, so it is present in the lymphatic system, then it will replicate and the microfilaria will be present in the peripheral blood. So this is the L1 larva. So means the this microfilaria, they are present in the peripheral blood. From there the mosquito, if any mosquito bite again this person, so the mosquito will take up the microfilaria. Now these are ingested by the mosquito, then it will 2 times molting they occur, so L1 becomes L3 and now the mosquito is now ready with the infective form. So now if this mosquito will bite any other person, so again it will be transmitted to that human being. Now we come to the pathogenesis, that is how your body will respond in response to the presence of this parasite. So basically the whatever we are noticing, that we are seeing that there is changes occur in the limbs in regard to this lymphatic obstruction. So mainly the tissue alteration which have been noticed in case of filariasis, they are related to the migration of the live adult worm, like lymphatic dilatation, thickening of the vessel wall, so that can occur. And why this tissue alteration is being noticed? Because this parasite is acting as an antigen. So your immune system will respond. Even the parasite is dead, still it will act as an antigen, its metabolites will act as an antigen and your immune system will be continuously active. Now along with this dilatation and thickening of the vessel wall, they can secondary bacterial and fungal infection can also takes place. So it's the host inflammatory response to both the parasites. Now as long as the worms they remain viable, the lymphatic vessel, although they are damaged, but still they remain patent. Means the uh, lymphatic vessels, they are still, the lymph can flow through these vessels. However, when there is death occur of these worms, it can lead to these are the your immune system reactions like granulomatous reaction followed by the fibrosis. So when this fibrosis occurs, so that can lead to the obstruction, and later on this complication can occur like that of elephantiasis, hydrocele. So the lymphatic function is mainly compromised. Now you can say it starts with the age of 5. So infection can occur to any person, but this microfilariasis, that means the presence of microfilaria in the blood, is more in the older age. It starts from 5 years and peaks at more than 30 years. Males are more commonly affected. In female, mainly their hormones make them more resistant to its infection. Now, both the response are altered in case of filariasis, and when these adult worm and microfilaria are present in the body, they both are being processed by the antigen presenting cells and they are presented to T helper cells. So, both Th1 and Th2 both are stimulated and differentiated, and then they play their role. So, the incubation period is about 8 to 16 months. Clinically, they can be categorized into the lymphatic filariasis, tropical pulmonary eosinophilia. So, lymphatic filariasis I have already mentioned that they can be acute manifestation or chronic depending upon the treatment of the patient, and in chronic they can be complications. Then the tropical pulmonary eosinophilia or the occult filariasis, then they can be certain immune complex mediated manifestations. Now, it can be in the endemic zone, the infection is there, and might be there may be no manifestation or asymptomatic microfilariasis. That means the patient is not symptomatic, but microfilaria is present in the body. So, in endemic zone, the person can be seen as normal, they are only carrying the infection. Now, the acute filariasis, in acute, when the acute presentation, usually the person will be presented with a high grade fever, and along with that the lymphangitis and lymphadenitis. So, there is only the inflammation, but when it and the lower extremities are mainly affected as compared more than the upper limbs. They can be transient local edema and dermatolymphadenitis. In chronic filariasis, if the treatment has not been taken, and so it can progress, the disease can progress and lead to the chronic filariasis where there can be lots of your immune system is taking place and immune system is reacting, so it is trying to healing, and there can be granulomatous reaction leading to fibrosis, so there can be complication of blockage of the lymphatic system. Now, these obstruction can lead to hydrocele, elephantiasis, chronic funiculitis, epididymitis, and the chyluria. So, there can be the inflammation of these, and in chyluria there can be presence of chyle in the urine. That is, the urine will become the you can say white colored urine will come. So, this is, you can see the swelling in the limbs, lower limb. So, it is the elephantiasis. Now, what is tropical pulmonary eosinophilia? Basically, you can see the term, that is eosinophilia. Usually in the parasitic infections, you will notice there will be raise in the eosinophil count, and there is pulmonary, that is the lung is something involved there, tropical pulmonary eosinophilia. It is also known as the occult filariasis. That means when you will test the patient for filariasis, you will not find the pathogen there. Therefore, it is being said it is occult filariasis. So, it is mainly a hypersensitivity reaction to microfilaria antigen. So, from the blood stream, your body has cleared the microfilaria and filtered, and it has been lodged and destroyed in the lungs. So, when this has been destroyed in the lungs, there has been an allergic reaction started to its antigens, and that will lead to the manifestations from the respiratory tract. So, microfilaria are not being detected in the peripheral blood. Circulating immune complexes which contain the microvilli, they can be deposited in various organs like kidney. So there it can cause proteinuria, hematuria, nephrotic syndrome in the joints causing the arthritis. So these are the hypersensitivity reaction like TPE, and these immune complexes can deposit. So other than that of your this main manifestation like of acute manifestation of filariasis, then chronic, but you have this allergic or hypersensitivity reaction or immune complexes depositions. So that is all for this. Hope you the topic must have been clear to you. If you have any doubt regarding the topic, you can ask me in the comment section. Thank you.